In today's fast-paced world, where information is abundant but sometimes overwhelming, it's crucial to prioritize the dissemination of knowledge around healthcare. Old extractive approaches to community research are no longer engaging and should evolve to improve engagement and put the community at the heart of research. In the United Kingdom, Centric community research stands as a shining example, utilizing a creative approach to engage with research participants, pushing the boundaries and perceptions of what community research can achieve.
When I initially trying to see what a community researcher is, or what I did initially think it was, I just thought of just someone that sort of works with community, more like a community support worker, sort of really integrated into the community's neighbourhood, that type of stuff. That's what I initially thought it was. But now that I've been doing a job and been doing different roles within it, I realised it's a bit more than that. It's not just with people down the street, which I thought it would be, and trying to convince them to go somewhere like the local youth centre. That's what I initially thought it would, I'll be honest.
Being a community researcher, you're able to get information or for people to be more open. You understand the situation the same as me because you're either living it or you've seen it.
Centric and Impact on Urban Health have joined forces to tackle health inequalities in Black, racialised and minority communities. This is an especially pressing need given the entrenched disparities and unequal health outcomes among Black and ethnic minority groups, compared with the majority white populations that are often rooted in different forms of discrimination and structural inequalities.
NHS, well,
I wouldn't want to go to A&E for nothing.
I have this problem. I've told you about it, and it's like there's no immediate reaction.
And the human touch has gone. You know, that feeling of empathy, that's gone.
I see it as though they're trying to tick boxes. And I don't necessarily make it seem like it's a race thing. But like you said, I think bias and race ties into it. I don't think you can separate the two.
Why community research? Well, at the heart of our approach is a commitment to engagement and inclusivity. We recognise that health research goes beyond numbers and statistics. It's about understanding the lived experiences of our communities. From the moment we begin recruiting participants, our approach is innovative and inclusive. In every step of the research programme, we involve the community. We celebrate research milestones with the community, acknowledging their role as active co-creators in the journey towards better health outcomes.
In terms of health inequalities, Elaine, do you think that community research is important to explore them inequalities?
Do you know what? There isn't even a question. That isn't even a question. It's essential. It really is.
And as a whole, the project, is there an approach, I guess, that you need to go in, or can you just go in cold, do you think, or is there a particular approach that was followed?
Yeah, I guess for this project, like Sophie, I mean everyone appreciates that it's different from what we've done in the past. Mm-hmm. So with dissemination of knowledge, we couldn't just use the same old method that the approach that we used for previous projects. Things have changed, So for this project, we had to look at different in terms of age brackets of people that needed to be in the room, the voices and the experiences that we wanted to kind of explore. So with this project, we had to go into kind of inviting young people. We need those young voices there. So specifically, we had 2 different focus groups with age group from 18 to 25 and those above 18. So to be able to compare the experiences.
And I feel like my own preconceptions of this, I didn't think it'd end up how it did, or I didn't think we'd find out as much as we did in the way we did. Was it similar for any of you that you didn't think your initial thoughts weren't how it went, or was it you seen the vision and then that's how it went?
I knew from the beginning there will be a lot of outcome in terms of learning, speaking to young people. When people start talking, sharing experiences around, especially information, how they kind of where the sources of their information, how they interpret information. You can clearly see that it's different from that generation.
They spoke about having like videos, focus groups, and it being all filmed. Having like really interactive focus groups. I thought, okay, this will be completely different, but in a good way. And it will be more like integrated with social media, I guess.
I think it's mad how TikTok's the new Google.
I know, that's me. I'm literally using
anything.
TikTok as a search engine.
We studied how health information is shared and consumed, and how this affects health outcomes in Black and minority groups. We talked to people in the community, had group discussions, obtained feedback, and brainstormed ideas. We conducted thematic analysis and looked for common themes in the information we gathered and found patterns that help us better understand the way health information is received and shared within our communities. While there will always be limitations to research, it did provide us with insights into the challenges and opportunities in improving health outcomes for minority groups across the board.
In terms of the project as a whole, how did it actually start?
I guess dissemination of knowledge. I'll say this project is like a combination of the work that we've done in the past. And I say maybe beginning from Intel gathering. I guess that project was focused on kind of exploring people's experiences, during the pandemic, and to kind of understand the support that was provided, then. And I guess from Intel gathering, that led on to Medscape. One thing I can tell you that if you look at those projects, from Medscape down to maybe health activism, down to 50 household project that we did, down to cost of living with people with multiple long-term conditions. The thing that I'll say the insight that remains, Black, I'll say marginalized communities, I'll say Black, Asian, and Caribbean, included communities have been kind of, have been sidelined, if I can use that word. They've been, as I mentioned earlier, they've been kind of neglected when it comes to health information. You can tell that everyone had similar, if not same, experiences in terms of what they face around health inequalities. So I guess looking at those projects and the outcome, like I said, the outcomes are similar, within those projects.
When it comes to lived experience, I think I didn't really relate to a lot of like inequalities that people had, but I think I definitely related to the part where I'd just rather not go to the doctors. Like I didn't realise it. It was only through this project that I actually realised what I do. So like if I've got an issue, my first instinct is to solve it myself, and the doctors comes a good few steps later. But I guess that's just what's been built into us. I think, especially as like in terms of youth, I think we don't really think too much about health inequalities, or not that we don't think about it, is the fact that we've not really got much information or anywhere really to look for that. So, but when it comes to learning about it, if you throw a blog in, from my own experience, if you throw a blog in front of me with all these words telling me about health inequalities, I'll probably read like 3 lines and that'll be me done.
So we talked about nimble, like knowledge production. That is that breaking down information, breaking down the jargons that there's using the health information, so that people can kind of so that information becomes accessible to to everyone, so that when you see information firsthand, it's easy for you to digest, and the interpretation comes easy.
So now if you show me a documentary, maybe I'll probably watch it. If you show me someone doing a podcast about health inequalities, I'm more likely to watch it. So I think a big thing is learning how different people learn in all age groups, and trying to disseminate knowledge in terms of health inequalities in the best way possible.
And I guess with dissemination of knowledge, what we've done differently to help with that nimble knowledge production is, for example, we're here, look at what we're doing here today. Traditional community research won't do this. Like you said earlier, that the experience that you had with community research is that people just talking to each other and just pass and forth. You can see that this is different. So what we've done around blogs, around podcasts, you can say more to that podcast. You can see that is a different game. it's a game changer, I'll say.
In terms of this actual project and approach, Sophie, what was the approach of the team for this?
I guess we had to be open, and how we learned. So I think I said before is working out what mistakes may have happened in previous methodologies and seeing how dissemination of knowledge can help health inequalities by addressing it through different medias, and how we can extract information from it, and what does it look like to the community or to the people that is engaging with it.
Thank you. And Elaine, do you think that the approach for this particular project had to be different to other projects you've been involved in? Or can you use the same sort of approach as you'd used before?
I'm struggling with that. I was going to say yes, and then I'm thinking no, because in many ways, the main thing we're doing is talking to people. And in doing so, in them telling us their stories, they are doing their own reflections and memories and putting things into place for themselves because they're vocalizing it.
Maybe when they're answering late and stuff, there's a lot of people that need help, a lot of people that may constantly say, my pain threshold's on number 10, or could be on the number 5. It's not as straightforward and as simple as how we may see it when you're going into the soil industry. There's a lot of time you have to put in, and of course you won't know every single thing. I'd rather trust a doctor that will Google something than me myself, because they still have aspects of different parts of everything that will link together. Or me just Googling something, it could be connected to something else, and I don't understand none of these terminologies, nothing. So I'm not like taking sides with them, but I think it's very, very, very easy when you're not on that side and when you haven't had any experience like with learning this stuff to be like, why is this thing coming late? Why are you taking too long to answer the call?
We celebrate diversity and recognise the strength of inclusivity. Our community research teams are intentionally diverse, reflecting the communities we work with. This approach not only enriched our research with varied perspectives, but has also fostered a sense of trust and comfort among participants. Engaging with future generations is also vital. We recruit and actively collaborate with young minds, nurturing a culture of curiosity and empowerment, shaping the thinkers, leaders, and researchers of tomorrow.
I'm Sophie. I'm from the Caribbean. I'm third generation living in Southwark.
I'm Elaine. I'm Jamaican born, Balham raised.
I'm Remy. I'm from Leicester, born and raised in Leicester. My heritage is Caribbean and Bengali, so half and half. Which I'm very proud of.
My name is Bukola. As you can see, Black African, Nigerian.
Can we agree that Ghana Jolloff's better?
Of course it's Nigerian.
But what made you become a community researcher then? How did you get into it?
Before I joined Centric as a community researcher, I used to work with young people, like do mobile youth work. From my experience there, I've seen like racism firsthand against black kids. I don't see what's being done. So ever since then, I've had this yearn to kind of do something better, to kind of have, to be able to speak to services, to authorities, to kind of change things.
I was nudged by a friend, reluctantly. I was nudged. I went to a meeting, found it interesting, had to go to a second meeting to make it look good. And then I started to get hooked into it. And it was like, this is really interesting. And I was watching the people around me, older adults, middling adults, people who'd brought their children because it was an after-school event. And even the children were being allowed to have their own group and their own say. I was impressed. And that was it.
So I've heard the term, but I've always wondered what it actually meant. So with me, I've always been able to be a part of different community initiatives, but not really finding out what the follow-up was. So they wanted to find out information, but we don't know where the information is going. So I thought if I can be on the other side of the table, I might be able to give that element to somebody else.
Do you think your lived experience prior to that has helped you with your work that you have done as a community researcher?
I think undoubtedly. I've been doing community types of work for a very long time, and I've seen changes over the years. As individuals, we can do better. We can engage with young people better and talk to them, not at them, so that actually they understand that it's not an oppositional thing, it's an inclusive thing, that we're properly trying to help. When conducting our research on the topic of health inequalities, there have been some revealing insights, from medical skepticism to experiences of service usage. The stories told by our researchers and community participants have been powerful and impactful to the health organisations and institutions for which our work has been conducted. Here are some of the key insights from our report.
Remy, in terms of social media and health messaging, what insights were uncovered?
Well, if you start from the fact that where people are getting them sort of their information from, so a lot of people were talking about how TikTok was one of them. Even myself, I said sometimes I will go and just type in anything because I use that as my search engine, and people were saying that they get it from YouTube as well, Google of course, and have a lot more doctors sometimes that come on these platforms as well. And I feel like some people think they're more easier to listen to, and it feels like they can actually probably find out a bit more than going and waiting for the GP. It's funny because not many people actually use the NHS website like I thought people would, but to be fair, I do it myself, so I feel like I feel more like I can trust, it sounds weird, but people on the internet that come from sort of medical backgrounds. Myself, I try to look for the more holistic approaches, so I do try and go for more like the natural doctors. From the insights when I was talking to the engagement group about it, they all said the same thing. And when you think about it in hindsight, the fact that these lot are waiting so long for their appointments, it only makes sense to just go and see what you can do in the meantime. I mean, it wouldn't hurt to find some sort of, remedy or option before getting a GP appointment. I think definitely video content or short film content seems to be the way to go with like conveying the messaging.
Yeah, and you spoke like you look more at like holistic like things when it comes to your health, but how do you then determine what's true and what's not?
I mean, some of this medicine is very new, and that's another thing. It's to do with the fact that you can't always trust some of these new, I guess, medicines, pills, all that type of stuff. So it's also about like doing your research of how these things help you or if they don't. So I think it's also about allowing people to do what they think is best for them as well, but then also making sure that there's probably some sort of protocol where they're fishing out all the stuff that's actually not beneficial at all. You should be able to choose what you think is best for yourself. You know your body best, which is something that I always believe in. So for me, I will go with the holistic approach first, and then if it gets worse and I think, okay, maybe this is not working, I will then go to the GP or the doctor. But I think holistic approaches always seem to work, and you have books, and some of these books have the same thing, and it's been passed down for like centuries, some of these remedies, so why wouldn't you? So I'd say it's quite difficult to determine, but again, it's all about what you think is best for yourself, I think.
And Bacola, and in terms of that social media and health messaging, from a point of institution, what were the insights there?
There's a decline in health messaging to begin with. If you look back in the day where you see on TV advertised like 5 a day, they was how to kind of use. It's everywhere you turn, but from the inside, from the comments, you can tell that in this day and age that's lost. That you hardly see things like that on TV or being advertised anymore. From institutional point of view, it feels like they've given up. They've given up on health messaging, believing that it's social media age, people can find information anywhere, so we just let them go find the information.
And is that the same for like blanket health messaging, or was that slightly different? What came from that?
In terms of blanket health messaging, that one I think is about using one term, like I mentioned, like one size fits all kind of messaging that has kind of failed to recognize like culture, faith and norms within those health messaging. So the term you use can, for example, people from a Black African descent, they might find it difficult to kind of break down, let alone understand. So with blanket health messaging, that linked into distrust that people felt with institutions. People don't, you said you don't wave, was it you said when you feel sick or something, you look at what you can do now before thinking about the GP.
The information they give is incomplete. So they want to make sure that information isn't bombarding everyone, but sometimes it's missing key elements from it or background for people to understand. It's like when you think of natural health, they'll be like, honey and lemon, but they don't explain why that works.
The kind of terminologies used in health messaging these days, with those that are available, as neglected or fail to consider the culture, of other people within the society.
And how do you think we can sort of make that information available for people? So not just saying do this, but this is the reasons why.
I think dissemination knowledge is able to do that because it can expose it through different medias. So it could be an infogram, or it could be a video like Remy was saying, about having that professional be able to break it down in a language someone understands, and then also having words but also a visual that shows it instead.
Sophie, from a participant point of view, what insights were uncovered around dissemination of knowledge and medical terminologies?
One of the interesting one I found was that members of the community said that if it wasn't for members in their family or their friendship group that's in healthcare to be able to break down the information for them, it made it a lot less scarier and they knew how to deal with it better.
There was people who had families that were in the healthcare industry, and obviously they said they were able to have a clearer understanding of certain things. But then people that are not, they sometimes don't understand it. And also another thing, language barriers, which is another cultural problem that was kind of raised, and it was kind of sad to see because they were having to bring extra people, weren't taken seriously because of the fact that English was not their first language, or they have some sort of accent. Through that, they're not able to get the right access they need, as well as the fact that they're not able to understand certain terminologies. I'd probably say majority didn't understand the terminologies, and it kind of reflected in the session. There was a lot of people not being able to be heard because of that.
Like, even from my point of view, there might be a medical terminology and I'd be like, I have no idea what that means and I'd need it breaking down. But then if you don't know anyone there, I wouldn't even know the first place who, like, person or institution where you go to find that out. As I said, it's more TikTok's gonna, like, I'll just search it 30 seconds and that's my answer to the question. From a institutional point of view, Remy, do you think the insights were similar in regards to dissemination of knowledge of medical terminologies?
So in terms of the institutions, I don't know what they're saying really, but I know from what we've heard from the community, it's completely off and something needs to be done about that. And it's kind of sad because I think from that, what's shown that GPs are not as charismatic and empathetic as they could be really. So I think that's another thing. Not only are they not teaching people, educating, because they shouldn't be just handing out prescriptions, they should be educating. So not only do you need to be sort of talking them through things, but also helping to understand, because if it wasn't for that, then we wouldn't have this problem where terminologies and certain things are not being understood by people.
When it comes to cultural knowledge, what were the main insights that came from that?
From what we had, it felt like institutions, like specifically health institutions, don't consider the fact that, okay, let me use London as an example, like it's a multi-diverse, like you can't say this is Pakistan and this is for Nigerians, like it's diverse. So they fail to put that into consideration when coming up with, information, their comms, when they put out their comms, to see that, okay, who is the target audience? Who are we trying to write to? Who are we trying to communicate with? And I think in health space, I would say now in healthcare, they've neglected that cultural nuances, the understanding, taking the time how to understand the people they're trying to treat.
When it comes to the participants, when you asked sort of so we talk about comms and what you're putting out, but who is this being tested on? Because it's not just one size fits all. And if you actually look at where they're getting information from, it might not necessarily be they've done any tests or medical tests like with black people. But then I find it interesting that in the focus groups, when you ask people, should black people be in the testing phases more, should we know more about it? And the answer is yes. But then if you ask the same individual, would you be willing to go through these tests? The answer is no. So then how do you, like Elaine, how do you think we get past that then? Because if we want to be involved but we won't do it ourselves, then who's going to do it?
It's complicated because living in this country, we have already collectively diluted our knowledge, our roots, our history. Ultimately, we have to get involved. We have to, because if we don't, we are the biggest losers, because we're already complaining that we are not included. Our views, our belief systems, cultural references aren't acknowledged. If we stay on that outside, the reality is we will get taken over, and we continue to do this. Skepticism, bad treatment as part of that journey that makes us more reluctant to engage with people. But if we can't find a way round that, if we can't persuade them to, we go and we say we're taking this or that, and they're looking at us, literally taken aback. Bitters? What the heck is that? What do you mean you clean your teeth with a piece of stick? I lived with African people who literally cleaned their teeth by chewing this particular bark. We were fascinated. They never used toothpaste. They didn't need a toothbrush. They had this particular... Do you see what I'm saying?
Mm-hmm.
We are losing those opportunities and that knowledge base. Other people will come and take it and use it, but not necessarily use it in our favour. If we don't get involved, if we don't have an input, we are excluded.
From a researcher's point of view, what was uncovered when it comes to engaging communities in health messaging?
Who's doing the messaging? The messaging isn't really aimed at us. The messaging from the health services is aimed at the wider population. Those of us who are affected, who need to take medication, will be drawn into that scenario and that picture. And as I previously said, by and large, they become reliant on the messaging that's being given to them. Take this X amount of times a day, don't deviate, keep within that boundary, and so on and so forth. A number of other people have different experiences, and perhaps are much more resistant, either because they have other people within their family networks that know more and can give them better, more targeted advice, or they have a family history of information use. There are many pieces of natural materials, herbs, spices, that are being very much more promoted since the pandemic.
When it comes to engaging communities in health messaging, Avocola, do you know, when it comes to institutions, how are they actually engaging these communities?
So when you ask, are they engaging at the moment, I'll say no, because they don't know how to. And I guess that's why they've come to organizations like Centric to help them kind of, build that bridge, of communication within themselves and the community. If you ask me, how should they even engage communities, I'll say it's crucial, it's important if they really want to kind of rebuild trust, I'll say, because the distrust is there from the beginning. Like, even communities don't want to engage in the first place. Mm-hmm. When you have projects, when you have workshops within the community, you have to kind of encourage people, try to kind of, maybe I'll say plead with them, because they've been in these consultations for a very long time without a tangible outcome, and that has built up, with time, the distrust there, so they don't even want to engage in the first place. So I'd say, at the moment, institutions don't engage because they don't know how to engage, but they should engage because it's crucial to whatever it is they're trying to do within the community.
They can't engage because they're too scared. They're scared. They're scared. They, if you like, treat us as if we are something very alien, because sometimes our voices are loud or strident. So they're pussyfooting around us and, if you like, being quite careful not to tread on toes. That's not helpful. Be direct, say what you need to say, but in a clear way. So what are we? We're people.
You also have the right people within the institution as well to even pass on the messaging, because a lot of them don't represent the people in the community either, so they're just outsiders coming in to a world that they don't know about really. So when they're trying to convey these messages or help us, they don't have a clue really.
I think the other bit is that a number of them are us, but they are constrained by the rules that they have to play within.
Yeah,
and that's a big issue. So they'll be used, but actually they can't be used effectively.
True.
Yeah.
Certain institutions have different motives for people like us being there in the first place. So it's not because you want to learn about our culture and you want our points of view, it's just so you can say the company is diverse, then you can tick that box off. In terms of fluidity and generational shift, Sophie, what were the insights that came from that?
It's not knowing prior knowledge. So some stuff for the different generations would be known, and it's not trickled down to the younger generations. So the younger generations is finding out what's going on or finding the information, but not understanding where it stems from, and thinking this is new. And it's like, no, it's probably older than the Bible. It's because they don't have that person, or things that was there in the past, for whatever reason, it is always ripped away, and then they come back and go, we're going to do this new initiative, and it's a bit like, it's not new. It's not new. It was there before, but whoever was in the higher ups or stakeholders didn't appreciate what was there in the first place, or didn't research enough to see what that actually meant.
So why do you think that has happened in your opinion?
I think it's training. I think it could be funding. I think it does stem from not understanding the community you're engaging with. So if you're going somewhere just for work, you're not really going to understand how the dynamic of the place or the biodiversity of it works.
And just off what Sophie said, Remy, how do you start to understand the community that you're dealing with?
Well, I think one good one would be actually providing jobs and getting people from the community to work for them, because you're actually getting authentic people that know about the community and who they're actually dealing with. So again, people like us that come from the community, and then to actually trying to actually empathise with us and not just come in and then I guess extract and leave. Is actually wanting to broaden their perspective and their understanding and actually help us, and that can only happen when they employ the right people from their side and to interact the right people within the community. And also, again, go to people who are creative, go to people with different sort of initiatives and diversify it so people can understand in different ways.
What insights were uncovered around systematic discrimination when it comes to health messaging?
I guess one of the insights I'll say from the participant was that within some organizations you have certain people who are so passionate, for example, I'll say maybe about things like inequalities and there. And when they were employed, they were told you were employed because, you are right fit for this job and you can help us understand this and help us provide a way forward. And getting to the organization, they felt so constrained to even do what they are employed to do. So I think discrimination begins from there. So knowing the right thing, but not being able to kind of action it, not being able to put any kind of solution forward. And I think that is grave, it begins from there. And that stems down to, things like comms, and the way the community is being approached. And the language is well used, to kind of communicate with these communities, because in the first place, if you don't understand them or you don't even care, discrimination begins from not caring, let's say that, like not caring about someone, not caring about, you don't look like me, I don't get to understand what you're going through, I don't get to understand your makeup, let alone provide any kind of a solution. So I said it's mostly from the institution. Discrimination begins from within the institution, and that steps down into what's offered to the community.
And just going back to generational shift, like opening up to everyone. So we spoke about information being lost through generations. So if I've come up in a generation where I've not learned maybe what an older generation has, the knowledge that's not been passed down to me, and all I know is what I've been told from institutions, and then I go into that very same institution, even though I'm from the community, I'm only able to spread what they've told me. I've not got no knowledge of the generations before me from the community. So where do we go from there?
System change has to start from the top. It's not enough to simply employ a wealth of, if you like, different personalities and regional peoples. It's not enough. If you're looking to change a system, then it has to start with the top. And they need to look at the structure of what they are doing, why they are doing it, and how best they should be doing it. They have staff on board from Asiatic, Oriental, African, Australia. They have a wealth of information coming from staff, or could be coming from staff. They don't make use of that. We also have a duty amongst ourselves to work harder at educating ourselves, but also our children and our wider families and our networks. We can't make anybody, any more than the health service can, make anybody change. But without the information, there is no chance of change on either side.
On what Elaine said there, Sophie, how do you think we can then pass on this information?
I think similar to what we're doing now, so exposing it. Some things get left behind or not said because it feels like it shouldn't be. And the fact that we're able to say, you know what, we're going to expose it, we're going to say what is missing, is good. And it's also not knowing what the other side of the table is talking about. Or when things actually finally do get to the community or the people it's going to affect, the decision has already been made. You just want us to tick a box that you've decided we're going to tick. So it could be anything from we're changing the way we're dealing with diabetes, but you've already made that decision how you want that to look. You didn't actually ask the community or the people suffering with that
What it should look.
Yeah, exactly.
Do you think people from the community should actually have a say in that process, let's say?
Yes, they have to be.
How do we get there is the question then, because we don't even find out that that's being discussed until they see they need it, sort of thing.
I think is being more exposure. So having the communities be a representation, but not just being there to fill spaces. Actually let them be heard. So even one of the insights from the community was, I want to be there. I want to be there when you're making decisions about me. I want to have ownership of whatever's been said and how that looks like, not today, but how it will look like in the future.
So I think as a community, when something doesn't seem right or doesn't relate to us, we should just tell them there and then. And that way it will get the institutions to start thinking more in detail about how comms should be delivered, certain events should be. I think we need to be a bit more hostile maybe, just so we can honestly let them know that this ain't for us. Because now I've seen on TikTok as well, there's people developing certain things for black people and for people of colour, and it's through small creators like them, but really it should be the NHS and bigger institutions to do stuff like that.
There is, if you like, the beginning of change. We have within Centric a patient advisory group service that was set up from a local perspective, emanating from Lambeth essentially, and they are using individuals to pilot a different kind of program and actually using the insights, the experiences of people with diabetes to inform that program. And it's run by Kings, and it's actually, it's quite widespread. I say there is one group within Centric, but I'm aware that Kings have rolled it out, the experiment as it were, in other fields. When communicating the findings of our research, we take the dissemination of findings to the next level. We embrace digital media, producing short films, podcasts, and interactive presentations to convey our research outcomes in a way that resonates with a wider audience. Our goal is to demystify research jargon and to make the information accessible to all.
Rory, how aware do you think the community is in terms of this research and the findings that have come from this project?
I feel like through the outputs that we did, people become more aware. But I feel like it's more prompted people now to go do a bit more research and dig in. So I'd say probably still not as aware, but it's now us doing this project has now prompted people. It's like a catalyst now for them to start taking on board what we said, what other people said, and the findings to go and I guess push this and amplify a bit more.
And in terms of like their day-to-day lives, like the community, because do you think that they'll realise, more of the community will realise the impact it's actually having on them individually more now due to the findings that we've uncovered?
Interesting. Yeah, absolutely. I think from the one of the focus groups, I remember that, you know, when other participants were talking about things like, you know, I would say sources of their health information. For example, when you talk about the natural remedies like fruits and all that, I heard some of them saying, after the focus, saying, "Oh, I never knew, you know, I can use that." You can tell that they went away learning a lot from other people's conversation, but from the fact that they share similar experiences, but I can say knowledge was shared in that, you know, during that conversation. And I think that alone, if that's the only takeaway message, I think they've learned something.
It's quite interesting because that's how aware the community is, and I think as the community we're quite aware of a lot of things. However, what we do with the information is a whole different thing, because I feel like we let a lot of things slide because we don't actually think we have the power to change anything. I don't know how we get out of that mindset, because I know that institutions do a lot of things wrong and they should be better than this and that, but am I necessarily then going to say anything, or where do I even go to say anything? Yeah. What do you think about that? Like, who can we speak to really about that?
I think Centric provides a number of people from local communities the beginnings of an opportunity to gain more understanding, more self-development and action. The more that we as a Centric group, and perhaps with other agencies as well, the more we do this and involve local communities and encourage their own thought development, then the more effective it will be, the more beneficial it will be to local communities. Same applies to the agencies who, if like, are running it. It's our job to encourage our people to represent themselves to these agencies who are set up to help them. That's their job. So now we have to, if you like, be better at doing our job, at helping them to help us.
How do you communicate like the findings that we've found, but in a way where like participants and the wider community actually feel like they can make a difference?
I think using what they wanted for the information to be gauged on. So like we were saying, TikTok, having visuals, having different means for them to be able to understand it. So if there is a difficulty with English or cultural, they can use technology now to be able to break that down without feeling I'm missing out.
What is the key takeaways you took from the project as a whole?
There's so many, but I feel like one of them being that we still are so underrepresented, and that we need to really push. And I feel like we have a lot of information, and I think the institutions make us almost feel like we don't know a lot when we actually do. Therefore, we need to just really push ourselves to come together more as a community. And I feel like we actually do have that. We just need to have things to facilitate that more. So what we've been doing has been really helpful. And I guess it kind of, in a way, encourages people to speak out more. We need to do more, engagement groups, because people feel more comfortable. There is quite a lot of work to be done within the health institution, and that also comes with education as well from the institution side. So we need to find a middle ground of being able to educate culturally, especially, because one thing I did see was a lot of people talking about how they're not feeling understood, whether it's the young or the old. We're on track to solving some of the issues, not all of them, to be honest. However, we're on track to solving some of them.
I agree with what you said as well, like about we actually know a lot, but we're made to feel like we don't really know anything. From a community research point of view, Bukola, what could be improved, do you think?
Seeing what we've achieved with this project, you know, I'd say institutions need to kind of think outside the box to kind of engage organizations like Centric, because most of our team member, not most, majority or all of our team members are people from the community. And if you're going to change anything, you have to, engage people who understand the background, who understand the nuances of that community. So I'll say my takeaway first, or the things that need to change, is that institutions need to whatever they're doing in the past is not working. So they need to think afresh and engage with organizations like us. That's number one. And number two is, one is to change. Maybe I will use the word change. I'll just say we need to continue what we've started with dissemination of knowledge, because I think it's good. I think it's great. I think the participants are kind of, they find it interesting to be engaged in a different way, different from just talk, just to talk to each other. They find it interesting. I think we just need to continue this, even maybe branch into other fields. But yeah, it is. We're on a great path.
But what if the institutions don't think they need to change? So then what can we actually do if they don't see there's a problem? How do we show them there is?
I think it's down to education. If we can find a way to educate them that what you're doing is not working, and we can help, so to say, that we can help, I think that should begin the conversation.
When it comes to creating policies and designing these policies and putting these services in place, Sophie, how do you think that institutions can better engage the community with that?
Just having the community be a part of it, co-design it. It's something that's going to affect them anyway. So, like I said before, it's got to do with ownership. If you're there from the beginning, you can understand the processes and the steps for it to, okay, this is what it's going to be as the final product. Where if you're only at the end or in the middle, you don't really understand why it's there.
And from the work that we've done, what conclusions have you drawn from it?
The importance of it and how it can be disseminated and spread to many different projects, and opportunities for others to kind of replicate that, but make sure that it's done authentically.
Elaine, we spoke about what we've learned and what's come from it and where we are now, but what comes next then?
More work from everybody, more honesty and focus. It will take, if you like, somebody's lifetime, but the reality is we have to get better at doing what we are doing and networking and liaising and holding power to account. It needs to be a movement, and collectively, it's not just us, but lots of minoritized groups. We all know what we mean when we talk about minorities. There are so many of them. And even those who are supposed to be mainstreamed are not being served in the way that they should be. We believe that better health communication will lead to better health outcomes. Whether opting for innovative focus group formats or engaging with diverse artistic mediums, it's about fostering meaningful connections with our communities and stakeholders. By pushing the boundaries of traditional research, we paved the way for a more inclusive, informed and united approach to healthcare dissemination.